late, but I'd like to introduce our guest speakers. It's my pleasure to welcome Cassandra Vanderlyn and Madison Finney from Aspira Retirement, both of whom have a strong history and passion for working with people living with dementia. There are so many options when it comes to finding care in retirement homes in particular. So they are both here today to increase our understanding in the differences between memory care and assisted living, so you can make more informed decisions when the time comes. We will have a little bit of time at the very end for questions. If you do have a question at any point throughout, please pop it in the chat and we will do our best to get to as many as possible at the very end if time permits. So I'm going to stop sharing on my screen, ladies, and you are free to take it away.
Perfect. So presentation's up. We will get going. Welcome, everyone. Thank you, Sarah, for the wonderful introduction. Like Sarah said, I'm Maddie, and my partner joining me today is Cassandra. We're going to take a look into understanding the key differences between memory care and assisted living options for your loved one. It's not an easy conversation to start or to have. Our goal by the end of this presentation is to help you be more informed to ask the right questions based on the needs we identify for your loved one. I'll start us off by talking about assisted living. So what is assisted living? Assisted living can be offered in two ways, a floor or a full home setting. When you come into an assisted living home or floor, you can expect to get help with any increased physical care needs your loved one might have. This would include things like bathing, morning and evening assistance, getting dressed or undressed, support with getting to and from all your meals and activities, whether in a wheelchair or using a walker. It would also include support with completing your laundry and daily assistance with any housekeeping needs your loved one may have, such as taking out the garbage or making their bed. Your loved one will have an assessment prior to move-in of those needs, and a detailed care plan would be developed based on the supports they require to complete their activities of daily living. You would no longer need to worry about if your loved one is eating nutritious meals, because all of their meals will be provided along with snacks throughout the day, as well as there's usually an area you can access within the home where you can help yourself to snacks and drinks. One of the biggest concerns we hear from residents and their loved ones is that they are concerned there is no easy access to medical advice when they are in the home. In an assisted living facility, you would have unrestricted access to wellness team members, such as PSWs and nurses, when you feel you need further advice or support, or even just to have your vitals checked. A trained team member is available for all your needs and reassurance if something really does feel off. We all know how hard it is to maintain a home and stay on top of all the upkeep within your home, including your appliances. In an assisted living facility, the maintenance team is at your disposal for any support with lighting, heating, or other appliance issues you may run into. They are always willing to assist and help in any way they can. Nurses, PSWs, and maintenance are just some of the many team members that work within an assisted living home or floor. This would be your loved one's home, and every team member in it works with compassion and respect while ensuring each resident's dignity is intact throughout their activities of daily living. We're going to watch a quick video clip about assisted living to further support the information we are providing you today. Once the video is over, Cassandra will lead us through a deeper discussion about the fit for assisted living and if it's right for your loved one.
My name is Merrill Gordon. I'm 94 years old and I live in assisted living. I decided to move to assisted living because my wife had passed away and I couldn't remember to take my medicines.
If you are living at home with regular home support, but find your needs are growing and becoming too unpredictable, then some form of assisted living might be right for you. Assisted living provides more flexibility to meet unscheduled care needs. Assisted living also provides help with meals, housekeeping, linen and laundry, and recreation services, all in a social setting.
Assisted living helps me with my medications, which are 3 times a day, and also with my compression stockings. And they come in and clean my room.
People often ask us what types of assisted living sites are available. Assisted living provides a private room with access to meals, laundry, recreation programs, a nurse available on site during regular hours, and a care attendant available around the clock. You have 2 options for assisted living sites. You may choose a private pay site, or, depending on your care needs, you may be eligible for funded assisted living. The government will subsidize the cost according to your income to ensure it's affordable for you. To find out more about what type of assisted living site is right for you, discuss the options with your community health nurse or call the Home Health Service line.
I enjoy the painting. We have a great recreation department here. I'm able to get up and go out to the golf course and have lunch with my friends or just a coffee. And I feel blessed that I have these abilities to do the things I do. Fraser Health helps me stay physically healthy and mentally healthy so that I can do the things that I used to enjoy and still enjoy.
Find more answers to your questions at fraserhealth.ca.
All right. So when is assisted living the right fit for you? I know that's a lot of the questions we ask ourselves along the way. So there is some things that you can kind of take a look at with your loved one's care to see if it is the right fit. So is your loved one getting tired preparing their meals or they're completing all of their daily chores? Do you notice overall they're becoming more fatigued and they're struggling to complete those dishes or prepare those meals? Are you noticing that those meals are maybe becoming less nutritious because they're just too tired to complete the meal they once were? Are you noticing because of those less nutritious meals, they're actually losing weight? You might actually also notice an increase in falling due to that overall fatigue that is going on. These are really signs that your loved one could be needing further supports. Do you also notice any issues with their personal care needs? Some of the things that you might notice in your loved one that they're continuing to struggle with would be wearing the same clothes every day, or maybe not changing from their daytime clothes to their nighttime clothes because it's just too tiring for them to do it twice a day. You might notice that they begin not brushing their teeth or not combing their hair, or they might begin to start asking you for more support completing these tasks. This also includes showering. So, are you really worried about your loved one showering at home? Do you notice that they're unsteady on their feet, or they could potentially fall in the shower due to their fatigue and weakness? You might also notice that they begin not showering altogether because they're scared and they're fearful of the shower. Another area to really take into consideration is medications. Medications are a big part of our day. And if you do notice that your loved one is beginning to not take their medications at all, or maybe they're going to start taking it at different times throughout the day. Medications really do work best when they're given at that prescribed time. If your loved one is taking it at different times each day or forgetting doses, the effectiveness of the medications is reduced, and you're not going to see those therapeutic outcomes that you really wish to see. With assisted living, medication management is an option that you can opt into, and they usually complete an assessment to see if your loved one is still capable of continuing to administer their own medications. By completing this program, it really allows for your loved one to have their medications administered every day by a trained care professional and know that they're going to get it at the same time every day. There are a couple more questions that we can ask ourselves when we're exploring if assisted living is the right fit for us. So, are you noticing that your loved one is struggling to keep their home free of clutter? You're noticing more piles around the house that they never used to have, or you're noticing more laundry pile up. You might also start noticing that they're becoming more withdrawn or they're bored at home. They're no longer completing those activities that they used to love to do. They're not knitting, they're not crocheting, they're not going outside for walks because they're just too tired. You might notice that they begin to become unsteady on their feet or they struggle to get upstairs. Overall, are you truly more worried about their safety at home? One of the areas that Maddie mentioned was the access to those maintenance services. And what we notice is that our loved ones begin to start asking us, did we change those furnace filters? Is our freezer working appropriately? If those are the questions you are asking yourself, maybe assisted living is the right fit for you. So if you answered yes to any of all of those questions, the conversation in your care circle should begin to talk about assisted living. But now let's look deeper into what memory care is, and I'm going to pass it over to Maddie to start this conversation.
So we've now reviewed the general needs and asked the questions about assisted living. We're going to take a look at what memory care entails and if it's the right fit for your loved one. Memory care focuses on the care of individuals that have increased cognitive needs. Memory care focuses on the care of memory care homes or floors recognize that every individual has unique values, a personal history, and a personality. Every person has equal right to dignity, respect, and to participate fully in their environment. Each resident within a memory care floor or home will have a thorough care plan created to ensure your loved one's specific needs are taken into account, and that even with a cognitive impairment, they are actively participating in their own care throughout the various stages of their disease. When developing personalized care plans, the focus is on a step-by-step approach to execute care effectively while incorporating your loved one's likes, dislikes, and past into routines to be successful in completing the care task at hand. This could look like starting music in the morning before care, or incorporating jokes to boost their mood, or even providing a cup of coffee or tea prior to starting their day because that's always what they were used to. These are the small items that need to be focused on to allow your loved one to feel calm and in control and part of their care. Throughout the various stages of dementia, the focus is to ensure your loved one feels a sense of self and purpose throughout their stay, which overall leads to better quality of life. Memory care environments speak to ensuring that we are providing the most adequate space for your loved one to optimize their quality of life. These neighborhoods are set up to allow someone to feel like it is their home, which allows them comfort within their current environment while supporting their independence and their safety. Most homes have specialized plateware to support the nutritional intake of your loved one. As with dementia, we see a reduction in vision as a result of the diagnosis. The color and contrast of the plateware will help your loved one see their food more easily, therefore increasing their nutritional intake. Different homes ensure that team members have adequate additional training on how to communicate effectively to enhance your loved one's experience while diminishing the anxiety or fear that can arise in someone with dementia. This can be done through various recognized dementia training programs like the Alzheimer Society, the Gentle Persuasive Approach, TIPA Snow, Dementiability, and there are many more. The reason this training is so important is because of how it can be applied to your loved one's success in their daily routines. Continuing on our conversation about what is memory care, we put a strong focus on how we can allow your loved one to be successful, even at the smallest level. We focus on what they can still do. This looks like incorporating them into daily tasks that use their skills stored in their long-term memory. Memory care neighborhoods often have them assist with folding laundry. Sometimes it's an engagement station, or sometimes we have them assist with their own laundry. To allow success and meeting your loved one where they are at, the staff use their training to know the best way to support your loved one to be successful with a task. In the case of the laundry, staff will determine the level of support needed to help. It could look different for each person within a unit, but it could be full support or having a staff stand by for assistance, or depending on their cognition and ability to complete a task, the staff member could set them up, leave, and do check-ins to allow independence with this task. It truly is whatever process works for your loved one. This is how homes utilize the specialized training to be able to meet your loved one where they are at in their journey, to give them purpose in their everyday life, personalized engagement plans, and using their past in the present. Other activities that your loved one can assist with is having them assist in wiping the tables after a meal, sweeping, dusting, or taking out the garbage, just to name a few. Another activity is letting them set the tables. It doesn't have to be perfect, but this is something that they can still do. Homes can even create resources to assist with completing tasks independently or with minimal help, to allow your loved one to still feel that sense of need and accomplishment within their community. An example of a resource for success would look like a picture of a place setting and how it should look, and then allowing your loved one to follow the picture and set the place settings. This allows independence and success, resulting in that feeling of purpose and accomplishment. To allow team success while incorporating these activities, memory care looks to break down a task into step-by-step instructions to allow your loved one to finish the first step before moving on to the second. This will help decrease confusion and allow that success that we have been talking about. You will notice a lot of memory care homes focus on the use of technology to support your loved one with a cognitive impairment through various online resources. It can look like iPads, interactive touchscreens, virtual reality sets, and even Google Maps to walk down memory lane and see their childhood homes. It also creates an opportunity to be able to travel to their favorite place they can no longer go, or places they may be asking to see again but cannot get there safely. This technology allows residents to experience the things that they may have done in the past or they wish to do, which can make them feel excited about moments throughout their day and overall reduce any frustrations they may have on a daily basis. Cassandra is now going to lead us in a further discussion about dementia care and how we incorporate their past life into their daily routines and how it is beneficial and successful to their transition and care.
So past life and dementia care, it's such an important topic for us all to talk about. Because as care providers, when teams look at your loved one's cognitive impairment, they see the person they were before the disease. They focus on that rich and that full life that they had. It included being a parent, being a professional, a housewife, maybe a brother or a sister, and ultimately a friend. All of these roles really make up who your loved one is and how they feel. The first and foremost important step is to be able to relate to and focus on what those past experiences were. This should also be informed by understanding their current abilities and interests, as Maddie said. All of our teams find out what they did for a living, whether they have siblings, what did they enjoy doing the most, whether they have traveled, or is there something medical going on where they're feeling unwell, or are they in pain? With this information, it allows our teams to understand who they were and how it changes their care needs. Everyone is unique. It allows teams to plan recreation calendars based on their current and past routines while involving each individual with their personal interests. An example I have for you all would be if somebody was an extrovert previously and loved to be in crowds and loved to go to events. Well, maybe instead of a 20-person crowd, we're now going to look at a group with 5 to 6 people. This is going to support the ability for individuals to communicate successfully, but have that meaningful interaction that they're seeking and incorporate their past activities. By creating these individual activity plans, you can then start to see a change in behavior. A lot of individuals are more satisfied with their daily life and overall have a reduction of frustrations from not being able to do what they once were, because they are able to do it in a different way. Other aspects which help us reduce frustrations is when somebody feels like they're part of their community. It gives them a sense of purpose. because this can be seen through maybe helping with the daily recycling routine, maybe delivering mail to every resident, or helping decorate for the upcoming season or special event. One of the things that's near and dear to my heart that we just passed was Christmas. It was so wonderful to see all of our communities and all of the residents and the joy that came from decorating for Christmas. By allowing these individuals to be part of their community still, this supports their purpose in their everyday life and ultimately will reduce those frustrations and allow them to have meaningful and fulfilling lives. So when is memory care the right fit for you? This leads us to start thinking about a few questions about their daily habits and their daily routines. Do you find your loved one is having difficulty finding their way home? Have you had any phone calls from your loved one where they're becoming more confused or they're lost on their way home? This could potentially lead you to have further questions about their safety when they're leaving the home. Are they going to get home okay? Are they going to get hurt? It's important to understand that this is your first sign that something is going on with your loved one, and it might be the right time for you to look into further supports. Truly, the earlier you investigate supports for your loved one, the easier the transition is for them. If you wait further into this disease process, it can actually cause further disruptions to their daily routines, which can have further effects on them and make for a really tougher transition because consistency is key. Some of the areas that you also might want to consider about habits at home: are they beginning to forget to turn off that stove or any appliances after they use it? In the beginning, forgetting to turn off the stove is no big deal. We might attribute it to just normal aging or forgetfulness. But the thing to really watch for is that frequency. Is it a one-off that they forgot to turn off the stove, or is it happening every time they finish cooking? Are they turning the stove on and walking away? These are signs that there is more going on than just forgetfulness. Also, take note if you notice that they're starting to have simpler meals, but they always used to cook a whole nutritious meal. Are they just not eating at all? Or are they starting to say they just ate lunch, but it's dinner time? Another area to keep in mind is the bathroom. Are you noticing more episodes of incontinence with your loved one? Or are you beginning to have to purchase more Depends, but you just bought a pack? These changing habits are a red flag that there is changes with your loved one and there's something more going on. Overall, if you are becoming more concerned with their safety in the home or are getting tired of those consistent reminders that are needed to ensure their safety, this is when memory care might be the right fit for you. Remember, the earlier you make this transition in your loved one's disease, the easier the change becomes. So let's hear some experiences from others on why making an early transition is key to their success.
For my mom, bringing her here when we did was the absolute best decision for her. Way better than being at home. She was depressed at home and wasn't active, even though through her life she's been very active. At home, she was not going out. She wouldn't go to the senior center, do classes. Her friends live far away. She was pretty isolated, and she's the type of person who likes to have people around and to be engaging with people and laughing with friends. So she seems genuinely happy in her present moment most of the time, like way more happy than she was the last several years before she came to Silverado.
After my mom moved in, I noticed that she was engaging more. She was at home at the time with my father and a caregiver, and they were somewhat isolated. So when she was here, there were other residents to meet and socialize with and eat with. There were other activities. There were other professionals working here who engaged with her.
If you can intervene early on and give them full life where they can engage and they can form meaningful relationships, continue to build relationships, and continue to keep their life full of purpose, you're going to have a much better outcome.
Waiting, I think you run the risk if you wait too long of having lost an opportunity through good nutrition, good supervision, and using all the resources they have to keep the mind engaged and keep your loved one socially engaged in a way that's impossible for most families to do.
Taking the uniqueness of a person, what they value in the present and the past, merged with just novel experiences, novelty in general with people, the activities that they engage in. It's just the perfect recipe for somebody to be able to thrive in a way that they otherwise just wouldn't be able to be at home. And it supports brain health. You know, we are creatures of habit, we are creatures of routine, but novelty is good for the brain, and Nexus will truly provide that while still tailoring to what is unique and special about your loved one.
When someone has a disease like dementia, you don't know what each day is going to be like, and you want to take advantage of those days. So you want to be able to be their spouse or their daughter or their brother, whatever it is. You want to be able to enjoy that relationship again and not just be their caregiver.
One of the wonderful things about stepping out of that caregiver role is it opens up that space for those old memories to come back and exist in. You're not day to day dealing with the dementia aspects of your loved one.
I'm very grateful because I got my life back and got to spend time with my mom in a pleasant way, taking her out to lunch, having conversations, reading her the paper, showing her photo albums, and hearing her stories. And when I was a caregiver, I was too busy taking her to the doctor and making sure she had meals, and that's all taken care of now, and I get to just be with her. It's a pleasure.
And this is really why early transition is so key to your relationship with your loved one. It can actually have a lot of added benefits. I'm going to now pass it over to Maddie to kind of review everything we've talked about today.
So in summary, we reviewed, talked, and gave questions to get you thinking about the key differences between assisted living and memory care and identifying the right fit for your loved one. After hearing this, we understand it really is a lot of information, and you do not need to be the only person trying to decide what truly is the best fit for your loved one. There are resources and healthcare professionals that can help guide you in the right direction. This was a start to the conversation you may need to have. Assisted living really focuses on the increasing physical care needs that your loved one might have to complete their activities of daily living. The access to wellness and additional support staff is required, and open access to engagement opportunities. Thinking back to the slides, if you answered yes to any or all of those questions, assisted living may need to be a topic of conversation in your loved one's care circle. And looking at memory care, it really focuses on the increasing cognitive needs of your loved one to complete their activities of daily living, while supporting their independence and ensuring a rich and meaningful life despite their cognitive changes, all while keeping them in a safe environment. This includes access to specially trained staff, therapeutic personalized programming, and specific individualized care plans. Thinking back to the slides, if you answered yes to any or all of those questions, memory care may need to be a topic of conversation in your loved one's circle. And always remember, early transition is key to a successful integration into your loved one's daily routine for both assisted living and memory care.
So thank you, everybody, for your dedication to your loved one's care and the work you guys do as caregivers. We know the beautiful challenge it can be, and we hope this gave you some insight and perspective into the future for your loved one and the supports they might require. Thank you.